Hey, I'd like to thank everybody for showing up today. And today we're going to be talking about the ABCs of mold, how to get things back on track, testing yourself and your home. So this talk is for the mold pros and it is on February 24th, 2021. And I am Dr. Matt Pratt-Hyatt. I am a PhD in cellular and molecular biology. I have been doing I've been in the mold field for about 6 years. I've been in toxicology for about 12 years. Actually, no, I'm sorry, it's about 13 years now. And I've been in the sciences for almost 24 years now. So it has been quite some time. So, what are we going to be talking about today? So today we're going to be talking about what is mold and mycotoxins. We'll talk about testings that had to be done in the body, and then we'll talk about in the home, and then we will say like what do we need to do to find mold in both and for like practitioners and remediators. Okay, so why should somebody get tested um, for mold? So first of all, if you or somebody in your family have symptoms such as fatigue, headaches, memory loss, nausea, um, abdominal pain, immune suppression, lack of muscular coordination. So like if you or some of your family starts becoming harder for them to like walk straight. We have seen like MS symptoms. We've seen Parkinson's like symptoms is tied to mold. Disruption of sleep is a very common thing that you see associated with mold. Um, One point is if anybody has any questions, feel free to like put them on the chat, and then at the end of the talk, I will be answering questions. So, what type of molds are there? Well, there's really two like big branches of mold. You have your xerophiles, which are your kind of like dry loving, which is kind of a misnomer. Then you have your hydrophilic molds. Xerophilics, even though we say they're dry loving, it just like means that they need less liquid or moisture than the hydrophilics. They still need quite a bit of humidity in the air in order for them to grow. So what are some of the requirements for growth? Well, you need a complex carbon source, and I'll talk about a little more about this in several slides when I talk about a study that a research team did on food source. You need sufficient moisture, and this really depends on whether it's a xerophile or a hydrophile. The xerophilic molds still need quite a bit of moisture, somewhere between 40 to like 75% of humidity is necessary for them to grow. And like almost all these molds, all of them need oxygen. There is no like anaerobic molds like bacteria, where there are some bacteria that don't really need oxygen to grow. Molds generally need oxygen for growth. Okay, so where's some of the species that we're talking about here? So the two main species that we're speaking of are Aspergillus, and actually these are families, and then Penicillium. And a limited number of fungal species will dominate depending on humidity and nutrients available. And we'll talk a little bit more about this in a couple slides. Okay, so we talked about our hydrophilic mold. So hydrophilic fungi. So in Greek, hydro means water and phylos means loving. And then, so you got your water loving fungi. And these spores are more often spread by water, insects, rodents. Some species will aerosolize, but not nearly as well as the xerophilics do. So you're looking for water damage, water staining, pipe leaks, roof leaks. These grow a lot slower than xerophilics. doing air sampling for these is fairly difficult and not going to give you a lot of good data. So unless you like do like a find the source, you're not going to find a lot of spores of these. Secondly, these are two like main types here: Ketotonium and Stachybotrys. And Stachybotrys is those type of mold that when you're like talking about your black mold, these are the ones that these are the families and species that you're looking at. So what are microtoxins? So microtoxins are toxins that are produced from fungus, because myco is Greek for fungal. So these are like fungal toxins. And there's over 300 different species that can produce toxins. Luckily for us, these 300 species will like really pretty much like break down to about 10 to 15 different families of mold. So a good PCR test will be able to differentiate between, which looks at the species more at the family level than the species level. You'll be able to like pick up a lot of these. And even better is that most of these like 300 different species only produce like about 10 to 12 different mycotoxins that are necessary or that are really like prevalent in the environment. But the exposure to these toxins are very can cause very severe chronic disease, such as like memory loss, fatigue, cancer, and multiple others. And I'll hit a couple of these in future slides. Okay, so here's some of like the structure that you're going to see for a lot of these different mycotoxins. And really like to take home here, these like toxins is they have a structure is very similar to VOCs. They are aerosolized like VOCs, so they are going to like be caught up in, and they're going to be in the air a lot more. These aren't heavy molecules, these are light molecules. So they're going to float through the air, they're going to land on your skin, they're going to be easily absorbed through the skin, or they'll be brought in through when you breathe in the like dust, because they will attach themselves to dust very easily. So what are the species that we really need to like look into when we're talking about mycotoxins? So we're talking about aflatoxins, B1, B2, G1, G2, ochratoxin, ruridin, varicarin, satratoxin, isosatratoxin, glutatoxins. These are like the most common ones that I have seen in the field. Obviously, there's other toxins out there. Ketonium, but these are the ones that I see the most often. So the mycotoxin that I see the most regularly in people and out of the environment is ochratoxin, and it's produced by two different families of mold, the Aspergillus family and the Penicillium family, and it can hit a lot of different tissues or organs in the body. It can inhibit synthesis of proteins, disrupts DNA and RNA. It hits the kidney, the liver, the spleen, the lungs. It can hit a lot of different targets. And the most common place that I see in large quantities of this are in food and water damaged buildings, especially the water damaged buildings for large amounts. Luckily for people, that most of the people that are going to be listening to this that are in the United States or in the European Union are there's agencies that spend millions, if not billions of dollars monitoring food stuffs. So you don't see a large amount of food sources that people are actually ingesting. You will see like trace amounts of mycotoxins that people bring in, and that's the reason why everybody has some background, or most people have backgrounds of mycotoxins, but large amounts are generally coming from the environment. Like I said before, ochratoxin is nephrotoxic, meaning that it's going to attack the kidneys. It's immunosuppressant, like pretty much all the different mycotoxins. It's going to impair the immune system. So not only do you see microtoxins cause damage themselves, they impair the immune system. So other co-infections can occur. One of the most common that we see here is Lyme. A lot of people that have exposure to mold and then later get exposed to the bacteria that cause Lyme disease. The reason why the Lyme disease becomes so prevalent in these patients is because the immune system has been suppressed. Ochratoxin, like aflatoxin, is carcinogenic. It's and like a lot of these microtoxins, it attacks the white blood cell, the myelin sheaths in the neuronal system, causing the nerve cells to apoptose, as well as in the nerves in the periphery, as well in the brain. Glutatoxin, probably the third most common mycotoxin I see. It's a known immunosuppressive. Does this by in two ways. It inhibits NF-kappa B. It also inhibits neutrophilic functions in the cell. Aflatoxin, probably the second most common toxin I see. It's produced by Aspergillus. It's classified as a class 1 human carcinogen. So there's like 3 main classes. Class 1 is definitely carcinogenic. Class 2 is it might be carcinogenic, and then class 3 is not very carcinogenic. It primarily attacks the liver, and the reason why it does this is because it actually gets activated by one of the cytochrome P450s in the body. So these are the things that are really supposed to be detoxifying the body, but with the liver actually causes the aflatoxin to become more toxic once it goes into the body. So aflatoxic, it's more toxic to human or to children than adults. And the reason why this is that children don't produce as much glutathione as adults do. So glutathione is the major process that detoxifies the body. So not having enough glutathione makes aflatoxin more toxic for children than adults. Aflatoxin has really been shown to cause mental impairment. I've seen a lot of like SPECT scans for patients to have large amounts of aflatoxin, and these SPECT scans will show that like there is loss of activity in certain parts of the brain. Abdominal pain is frequent from aflatoxin, headaches, jaundice. Trichothecenes, these are probably the most toxic of the mycotoxins, but the ones that you're going to see in the least abundance. But because they are so much more toxic than the other, especially like ochratoxin, glutatoxin, aflatoxin, these ones are like the ones that are produced from different species, mostly from Fusarium and Stachybotrys. Okay, so I talked a little bit about the molds need a carbon source in order to like make mycotoxins. And this is a good paper from the year 2000 that talks about what type of mycotoxins are you going to find in a home, and what are the molds growing on to produce these mycotoxins. Okay, so this paper looked at different food sources. So you got cellulose, gypsum, mineral wood, plaster, synthetic material. And the take-home message here is you see like the cellulose has a lot of mycotoxins on it, gypsum, lots, synthetic material, lots. These are all like the main ingredients you're going to see in drywall. So drywall is the like candy for or for molds. They love drywall. It's a great food source for them. But plaster and mineral wood, not so much. And that's one of the reasons why I see homes built in the 1800s, early 1900s to about 1930, 1940, when they started making a switch over from plaster and brick over to drywall. Homes in the 70s, 80s, 90s, 2000s, much more prevalent are able to grow mold. I'll see a lot more homes that are built in the 2000s with mold problems than ones that were built in the 20s, just because of the overabundance of drywall in those homes. So somebody in your family is sick. We suspect it's mold. So what do we do? And there's 3 steps here: testing, remediation, and prevention. And I'll go through all 3 of these here in the rest of this talk. Okay, so testing. Okay, so someone's exhibiting these symptoms that I just talked about. You got memory loss, or you got like Parkinson's-like symptoms, fatigue, headaches. Okay, so first we got to test whether or not the patient has mycotoxins and maybe mold colonization. When I say mold colonization, it's also can be referred to as mold infection, where you have like a mold forming a biofilm in either like the respiratory tract, in the sinuses, and sinuses can be in like this area, like underneath the eyes. It can be a little bit, there's like sinus cavities behind, like underneath the eyes, and this is like causes like a sinus pressure. And about 15 to 20% of sinus infections are caused by mold. The other 85 to 80% are caused by bacteria. Okay, so how to find out if you have mycotoxins? The best way to do that is through one of these 2 labs here. You got the Great Plains Laboratory, which utilizes LCMS technology to measure urine mycotoxins, and you have Real-Time Lab, which uses ELISA to measure mycotoxins. And both of these are extremely important for measuring how much mycotoxins are coming out of the body. Making a guess is not, I mean, important, useful. And this is like, especially for practitioners out there, this is really important for being able to like ascertain how well treatment is going. This will help you if you know, this will be like the first step in figuring out, do you have a problem? Is mycotoxins leading to your problem? Then you can like lead you into like home testing. So if you have a positive results from urine mycotoxins, then you need to like figure out, well, what's the cause of this? And there's 3 like main groups here. Are you having current exposure? So this would be like work or home. Past exposure. Toxins can take months or maybe even like up to a year to 2 years to get eliminated, depending on glutathione levels, how well the detoxification pathways are working, how much adipose tissue the patient has, because these mycotoxins love to bind to adipose tissue or fat. And when it does that, it might take a while for them to be removed. Or like I said before, we could have a current colonization. I've talked to maybe a couple hundred different patients where they lived in a moldy home about 5 or 6 years ago. They moved out maybe like 3 to 4 years ago. They've not felt well in the last 6 years. And what we find out is they have really high mycotoxins. Their current home is fine, no mold at all. But what they found out is that they have a mold biofilm growing in their body, and that has to be treated. So there's a lot of practitioners out there that have really good treatment plans for dealing with these mold biofilms. So finding a good practitioner is very important. And one thing that we're working for in the Mold Pros is that we're building a search function on our website to help you be able to find a practitioner that has experience treating mold. So with the Mold Pros, we have the 3 M's. And we have moisture, mold, and mycotoxins. And I'm going to hit all 3 of these and how these can help you like understand of how to like treat a home. Okay, so first we got, so when you're assessing a structure for those with environmental illness, we have to do a couple different things. You can assess with the beginning with an interview of the occupants. Are you getting better from being away from your home? I mean, I've had patients that have moved out of their house maybe like 6 months ago. Ever since they moved out, they start feeling better. This is an indication that the home is definitely the source of the mycotoxins. Other thing that you can like ascertain is, are there odors? And if so, what parts of the house have the most odors? This will allow us to like figure out where exactly in the home the mold growth might be. So then first we need to make sure if there's already been testing done, how was the testing done? There can be certain biases that can occur if you are oversampling from a certain part of the house that can not be very indicative. But the lab data tells us the what, but the inspector or the investigator can tell us the where and the why, and that's where we really shine. Is that we were going to spend a couple hours, 2 to 3 hours in your home, identifying the source or sources is the primary objective of all this inspections. Because when we do inspection, we want to help you find the source is, but then we also want to be able to find all the sources so that we can guarantee to you that you're not going to see mold coming up anytime in the near future. What do we start with? Well, we first start with exterior inspection. Are your gutters working properly? Is there cracks in the foundation? Is there a runoff problem where water is building up in certain parts of the house? What's the roof look like? Then we'll look at penetrations in the structure, checking for water intrusions, either chronic or acute, leaks, storms, roof damage, drainage problems. After that, we'll conduct a visual assessment of the entire interior of the property. And we, as we say here, we go from the bottom all the way up to the top. So if you have a basement, we're going to look through your basement, the bottom of your basement, all the way up into the attic. We want to look for anomalies such as decolorization, water stains. We're going to use high lumen flashlights and black lights. We're going to do infrared, which I'll talk about. We're going to do moisture meters. We're going to inspect first, then sample to validate your concerns. Develop a sample strategy for your differential environmental diagnosis. I'll talk about we're going to do surface sampling and air sampling as well. So the first step here is moisture. And as inspectors, we are trained to look for water damaged buildings, but we need to start thinking of moisture affected buildings because it's not always water damage. You could have a home that the AC is not working properly, where the humidity is not being removed from the home as well as it should be. And like I said before, homes that really get above 50% humidity are ideal growth places for both xerophilic and hydrophilic mold. Water damage is not required to have major fungal or mycotoxin exposures. We'll see a lot of homes that have mold growth just because this is caused by high humidity. So we will go from the foundation to the roof decking using our moisture meters to determine how much moisture is in different, and what the humidity is in every different room. We're also going to bring our infrared cameras here, and this really helps us identify parts of the house that have water damage, but water damage that is not easily seen. As you can see here in this picture on the right, you're going to see some water damage, which is not very indicative here on the other picture. So it's water damage, which shows up as a blue spot in our infrared, shows part of the house that's cooler. Building testing. So there's several different tests that we do, and I'm going to talk about how that we do those tests. So we utilize multiple forms of testing. So we want to make sure that we have the best and most thorough picture of your house. And we're going to test for multiple different things because we don't have to say that one thing is what's causing your illness. So we're going to look for mold and mycotoxins, of course, but then we can also look for bacteria and endotoxins. We're going to look for volatile organic compounds, these VOCs. I'll tell you, a lot of my patients, one of the problems that they have frequently is once they get exposed to mold, they very frequently develop what we call chemical sensitivity. And this chemical sensitivity can lead to them not being able to be close to any like cleaners or perfumes. And so we're going to try to like see and help you minimize the amount of VOCs in your home. Okay, environmental sampling. So what kind of sampling are we going to do in the home? So we're going to do spore traps in multiple different rooms. We're going to do surface. If we see like a mold sampling, we're going to do a tape sampling of it. These tests are very inexpensive. It allows us to help us figure out which rooms have been exposed to mold the most. So we're going to do like microtoxin sampling in only 1 or 2 different parts of the home most of the time. We'll do spore sampling in multiple different rooms as well as outside as a control. We also could do invasive sampling. So sometimes, especially with Stachybotrys, you can have molds growing behind the walls and behind the drywall or behind the ceilings. So we'll do some, if it's necessary, we'll do some invasive sampling inside the walls in order to like try to like find Stachybotrys. One of the weaknesses of this is spore traps. Is that sporulation cycle. You may not capture hydrophilic molds such as Stachybotrys. Like I said, Stachybotrys is the one that likes to hide behind walls most commonly. So you'll very frequently see for Stachybotrys like high trichos in the microtoxin sample, but you'll see low spore counts in the living area. That's because the spores are trapped behind the walls, but the microtoxins are not. So a lot of this has to do with like a lot of these samplings have to do with what's called PCR. And this is a polymer chain reaction. There's multiple different tests that run this, and I'll talk about that in the next slide. This is a DNA test that looks at spores, biomass, hyphal fragments. It's easy for the consumer to perform it themselves. We can send them a kit. They can collect some dust from around their home, send it back to us. We'll send it to the lab, and they'll identify it. It can be kind of prone to sampling bias. So if you test it in a room that doesn't have a lot of mold in it, it can come back as a false negative. If you test it in a room that has a ton of mold in it, it can give us, I could say that like, well, your house is much worse than it really is. So that's also the reason why we do the spore trapping. And like I said before, there's multiple different versions of these PCR tests. You got the URMI test, looking at 36 different species of mold, which is brought into 2 different groups. You got your pathogenic group and your non-pathogenic group. You got your ARMI, which is 13 species. You got your Hurts Me True, which is 5 species, and you get your EMA, which is 10 species for mold. And then you got your 15 or 16 different species of microtoxins. Okay, so let's go through some like possible scenarios here of what you could possibly see. Okay, so we have a client, and they have mold that's caused the mycotoxins in the EMA panel. So the mycotoxin detected, but no mold is found. So what are some of the reasons why this could be? The mold might be dormant. So especially like cold seasons, like during the winter, if the basement or other parts of the home or inside the walls gets very cold, the molds might become dormant, and you might not find, if you've like cleaned sometime in the last month or two, you might have pulled or cleaned up all the spores. So when we do a testing, you might get lower values. There might be lower humidity or moisture, especially during the winter months where things are typically more dry. This could cause less spores, but more mycotoxins. VOCs produced by other organisms may be inhibiting the mold growth. Other common thing that we see, you had a remediator come in, they tore a whole bunch of walls, but they didn't treat the carpeting or furniture for the microtoxins. So that's another like common scenario that we can see is we'll be like the second group in, and we'll have to like treat the home again because the original company did not do a thorough job. Okay, so what is also, this could be a sampling issue, dust from frequently cleaned areas, as I said, sticky molds could be a problem. What if the mycotoxin is not part of the EMA panel, such as ketoglobicin? Since both mycotoxins and DNA are conducted in EMA testing, it can be ascertained that there's a problem in an environmental situation since one or the both of the components are determined. Okay, so how to sample? Well, the thing that we really love to do is do dust from air conditioning filters, because this is pulling air throughout the house, and this could be placed in a biohazard bag or a clean baggie. Or we can take dust from vents. About 1 to 3 grams is useful. Samples should be placed in the biohazard bag. You can do a part of your AC filter. So you can take the portion of the filter, put that in the bag. Vacuum dust, the dust on top of shelves, under the refrigerator are also places that dust can be collected and sent to us. Okay, so the next part is treatment. So we figured out there's mycotoxins and mold in the home. What do we do? Well, we're going to have to pull out the parts of the house that have the mold on them, and then we're going to need to treat for the mycotoxin. The way that we like to do it is we like treat with an enzymatic blend that we have, that we are patenting, that will metabolize the toxins into safe metabolites. By using this blend and not harsh chemicals, it makes it so the house doesn't have a whole bunch of VOCs in it after we leave. So that's our goal, is that we want the house to be as safe and as livable as possible after we vacate it. So using this enzymatic blend, and the mold probes have a proprietary process here. We use these enzymes to degrade the mycotoxins in the molds. It's much cheaper than a full tear out. We try to tear out as little amount of drywall as possible. We're not using any harmful chemicals. And so here's a paper that was published about 15 years ago looking at different enzymes that can degrade mycotoxins. What they showed here is there was like 7 different enzyme classes. And the first 3 here are the ones I really want to like point you towards. You do a combination of all 3 of these different enzyme classes. Enzyme class 1 really attacks the aflatoxins. Enzyme class 2 goes to trichos. And then enzyme class 3 does the zearalenone and the ochratoxins. By combining all 3 classes, you really can degrade a majority of the mycotoxins out there. You can do this in a safe and green manner. And our tests have been scientifically validated. We sent this sample to a lab, and there was actually 5 different samples here. And I'm just showing sample 1. All 5 of them show exactly the same thing. I didn't want to over-clutter the results here. So, but you can see here, sample 1, you get really high amounts of ochratoxin, medium amounts of aflatoxin, and a high amount of glutatoxin. On day 0, you saw high amounts, but then on day 1 and then so forth, we tested for 1 day, 7 days, 30 days. You can see here no mycotoxins present after day 1. So within 24 hours, all the mycotoxins have been degraded. We also use a state-of-the-art property called Opa Filtration, which is twice as good as the HEPA filtration. It captures down the particulate size of 0.1 microns. These Opa vacuums are a lot more expensive than the HEPA ones. but we put our money where our mouth is and saying that we're going to clean your house using the state of the art facilities. So Opa Filtration instead of HEPA filtration. So here is a result from a home that we just recently remedied. It had some aspergillus contamination in here. You see some fumigatus and Niger. More importantly, you saw high amounts of the glutatoxin derivative. But really for almost all of these, I'll say that pretty much almost all of these for homes, you don't see a lot of microtoxins in a lot of homes. Unlike humans, where you could do the same test and see these type of results, these ones right here, because humans eat a lot of foods that have small contamination of microtoxins, you're going to see a lot in urine tests. You're going to see a lot of background. Since homes don't or eat any microtoxins or molds, you're not going to see these backgrounds in homes more regularly. So I really like to see zeros in these. So after we treat here, this is more of what I see from a lot of homes. And I've done a lot of testing for people that have wanted to buy a home and they want to make sure that it's clean. And this is kind of the result I see a lot from these home checks here, where they want to make sure that their home is clean. So you see 0 amount of ochratoxin, 0.02 on the aflatoxin, tricho 0, glutatoxin 0, zearalenone 0. We always do these post tests afterwards to make sure that the home has been treated properly. So the third stage here that I really wanted to hit on was prevention. And that's the other frequent question that I get a lot is, okay, so I've treated my house, I treated myself, which is equally important. What do I do to prevent this from happening again? And one technology that we've started utilizing recently is what's called the Easy Breathe. And it's a very simple instrument that pulls humid air out of the lowest part of the home and sends it out of the house. There's no filters that need to be replaced. It's been shown to reduce high amounts of mold and microtoxins. I'll talk about this. Here is one result that we see here. So you got a home here from 2709, and you'll see that it has really high amounts of aspergillus. With no remediation at all we did was put in an Easy Breathe in here. You see the aspergillus spore counts have greatly decreased. This is a very important take home. Now, obviously, this amount of aspergillus is more than I would like to see, but this is going to greatly reduce, especially in a house that after we've remedied, this is going to prevent future occurrences. So a lot of times in the homes, we do recommend putting an Easy Breathe unit into the lowest part of the home, either in a crawl space or in a basement. This is kind of how how the whole system works here, where you have these toxins floating around, and then the Easy Breathe unit, either in a slab home, is going to pull it out. If you have a crawl space, the toxins are moving around. The Easy Breathe toxins frequently will get attached to the moist air, which then sinks, and the Easy Breathe unit eliminates it. Same thing with a basement here. You got the air moving around the first floor. The Easy Breathe unit will remove the moist air out into the home, removing spore counts generally with it. So, last slide here. Why are the mold pros better? Well, we use quality labs. We can utilize urine sampling. We utilize spore traps. We utilize EMAs and ERMIs for environmental sampling. We look at, we can look at tape sampling. We use no harmful chemicals. Generally, people can be out of the home for maybe 24 hours so that we can keep the chemicals sitting in the air as well as on the surfaces without being disrupted. Usually after 24 hours, people can come back again after our fogging. In the fogging, we do both surface guard and air guard in the home, and these will eliminate both the mold and microtoxins in the home. We try to do as much as possible so that you can like keep your possessions. We don't want you to throw out things like furniture or carpeting if we can get away with it. We want to try to like make sure that we don't have to like rip out drywall if we don't have to. We're trying to like lower the cost as much as possible for you. Okay, so I'm going to answer a couple of questions here. First question is, can I comment on Dr. Andrew Campbell's claim that urine microtoxins is worthless? Yeah, no, I've had to deal with Dr. Campbell for the last like 6 years. And I know he's got this blood test which uses antibodies towards microtoxins. Microtoxins don't stay in the blood that long. They're staying in tissues, they're staying in the gut, they're bound to different parts of molecules. Testing in the blood is not going to give you an accurate assessment. Urine microtoxins, either from Great Plains, real time. I've heard vibrant, I can't really say. I've heard a lot of like things saying that vibrance testing is not as sensitive as the other two. Does Mold Pros do any training or certification for local remediators? You can like contact me afterwards and we can talk about what type of training we can have. We have a lot of inspectors that we use throughout the country. We are building a whole new website that will be coming out in probably in April. It's going to have two different aspects to it. It's going to have a search function for inspectors and remediators in your area. It's also going to have a search function for any practitioners in your area that do mold work. So we really want to help patients be able to find both inspectors and remediators. Because like I said before, it's really important to treat both aspects of your life. Your body is obviously important, but in order to like get better, living in a non-mold infested house is just as important because it's very hard to be mold free if you are continually breathing in microtoxins day to day. Any other questions that anybody would like to answer? Like I said before, we are recording this. This will get put up on our website in the near future. Also check back for our website for our blog post on our website. They can be found under the Learning Center. And then also check back in April 2021 for our brand new website. We'll have a lot more info on a lot of different things. It's going to be a lot more user-friendly. So be on the lookout for that. Lastly, look out for us at our some of the conferences this fall. iLads, ICI. We hope to be in attendance for multiple different conferences in the fall, and we love to see you there. So please come by and say hi, and we'll see what we can do. Feel free to contact me at Dr. Matt, dr.matt@themoldpros.com. Again, that is Dr. Matt, Dr. Matt at themoldpros.com. Thank you so much, everybody, and it was very nice talking with all of you.